I would now like to introduce you to Mia Puppich, who is one of our current students. I'm not going to introduce too much information because I'll let Mia talk to you all about who she is and her experience studying at UWA. Thanks, Mia.
Hello, everyone. So my name is Mia. I'm originally from Vancouver, and I'm studying my postgrad here at UWA. And I'm more than happy to answer any questions that you have about the student experience and what it's like to be in medicine. So things I love about Perth is mostly the beaches and the coffees. There's interesting things to do like art museums. The campus is extremely beautiful. So if you're studying on campus, there is Matilda Bay, which is like a 5-minute maybe walk from some of the libraries, and you can go and have a coffee there and just decompress with studying. And then things I really love about the MD program is that you dive into clinical teaching quite early on in your medical degree, which is very useful. The first little bit, as Scott said, you focus on the theory aspect of medicine, and understanding how someone gets diagnosed with a certain condition or how you can manage. But once you're in the hospital, you get to consolidate a lot of that knowledge, and you get to practice a lot of the examinations that help you determine a certain diagnosis. So I found that really useful. I'm very much a hands-on learner. So being able to dive into both clinical teaching, hospital teaching, outpatient teaching as well is really useful. And I feel having that experience builds the confidence to be a better doctor. And that's something that UWA offers. When I was looking at universities, that's one of the main things that stood out for me. I really love that about UWA. Another really awesome aspect about the MD program, and also Scott briefly talked about that, is the elective or selective option. I personally did my elective in Perth, and I focused on a specialty that I found interesting and wanted to know more about. And that experience was very insightful, and I built a lot of networks in that specialty. And it just helps you open up doorways as to, what avenue you want to go down in medicine, especially when you have those networks. So I loved my elective experience. And even outside of that, even if it's not a specialty that you're interested in, I've networked with so many different doctors and who've become mentors, and they also take time to teach you about certain things that you're interested in their specialty. One of them, I was recently on oncology and hematology, and I just found it absolutely incredible learning about it in a classroom setting versus hands-on in the hospital is two different experiences. So I quite love that as well. So overall, you will have a really fun time. I mean, medicine is full on. We all know that, but overall, it's an incredible experience.